untreatable pain has multiple parts. What it basically asks is that the patient has tried all of the other pain management options that a patient may have, and none of those have succeeded.
Including opiates?
Including opiates. So,
really? So that's okay, but this isn't?
that's kind of been our problem, and interestingly enough, it's been the feedback that we've heard from doctors is that what they don't understand how to read this. Does that really mean that for every single patient, I'm supposed to have taken that patient through surgery, I've had to take them on an opioid regimen, and that didn't work? What we've noticed so far is that some docs are interpreting it differently. So there are some that are really working closely with the patient and saying, look, if you're not comfortable taking opioids, then we're not going to try that. What we've heard from other physicians is that I don't know what this means, I don't understand this category, I don't understand what all of these pieces to the law mean, and I'm just not going to address it. So we think it's probably one of the most important things that needs to be worked on, if indeed the people, again, who can be served by this program are actually able to be served. It's certainly something that I think exploring that if you or someone you know fits within that category, exploring that with your physician is very important, and explaining, look, I'm not interested in having an invasive surgery maybe, or I've tried an opioid, or I don't even want to try that. And that I'm interested in this program and seeing if this might be an option.
With having done that, or if you do that, then it is legal? If the physician agrees that, yeah, opioids aren't right for you?
Right, so we'll get through we'll get to the steps of getting the card, and basically what it would require is that the physician has said, yes, you do have untreatable pain,
okay,
and you haven't decided to,
There you go.
whether it's you've tried it or you just simply don't want to, and it doesn't make sense to do treatment.
Poison.
That's what the physician would be certifying.
That's basically it.
But it is mandated that the physician does certify that, correct?
Correct,
Right,
and
right.
that's exactly what we'll get to right here,
Some of
on
the
how you
doctors.
actually access this program. So it seems like a good amount of people in the room know how to get a card, or maybe actually have already done so. But for those who don't, or making sure everyone is able to explain it to friends and family members who may be interested in participating, it's a multi-step process to get a card, which is of course the first thing you have to do before you can obtain products in Iowa. So the first step is downloading the application. It's on the Iowa Department of Public Health website. It's also available on our website. You can find a link to it that'll take you right there. That application is a couple pages long. You gotta print that out, and that's the application that you actually take to your physician. And so what your physician is doing is not prescribing medical cannabis. That's not actually legal for your physicians to do. Instead, what they're doing, and what the application takes the physician through, is certifying that you have a condition. So it's stating that you, patient X, has cancer, or has HIV, or has MS, or has one of the conditions that's listed as approved in Iowa. And so the doctor certifies that you have that. The doctor's also responsible for signing his or her name to that form, and then that form is what gets turned into IDPH, which is the next step. I'll mention quickly here that physician does indeed mean someone who has an MD or a DO. Under our program right now, nurses, PAs, other medical providers, unfortunately, regardless of how involved they may be in care, are not actually able to sign the certification form. Again, especially in rural areas, I think an improvement that can be made to this program, but for right now, it does require that a physician sign off on this application.
And one other quick thing to note is that many that have specialists, it does not need to be your specialist that signs off. It can be anyone that provides you care and has a relationship with you as a doctor-patient relationship.
Does that need to be for 3 months, or does it matter?
There's not a defined way in the law. There's some other case law across the country that kind of sets up some ideas. Basically, what the doctor should be doing is at least understanding your medical history. Certainly should have